Hi everyone. Today I'm here to discuss about our new topic, that is prosthodontic management of endodontically treated teeth. How you can treat a tooth which is root canal treated in a prosthodontic way. The usual manner of treatment is familiar with everybody. You all know you have to give a crown for root canal treated tooth. So that is a usual way which I am not which is not my topic of interest here. So I will talk about the unusual methods in which you can rehabilitate such root canal treated teeth. The unusual methods or ways means if the particular tooth which you are going to give a crown has a severe coronal structure loss due to various reasons. It could be due to extensive caries also. If there is a severe coronal structure loss, then the tooth become weaker, and if you give a crown, the chances of crown dislodgement along with the coronal tooth structure is more. So in such cases, how can you reinforce that tooth so that you can improve its longevity with the crown? So that is my topic of interest in this chapter. So I'll start with a clinical scenario. When you get a case like this in your clinic, this imagine this is your patient who had undergone root canal treatment on this particular tooth, and you have given a crown, and before 1 week, and just after 1 week, uh, the patient, if the patient rushes to your clinic, how will you treat this? The patient is carrying that particular crown in her or his hand, and patient is asking you to fix it. Then how are you going to fix it? That is the main objective of our topic. So in this case, you may feel like fix it with a good cement. That is the best cement which is available nowadays in market is resin cement. If you fix the crown, when you gave a crown, there was more coronal tooth structure like this. Somewhat like this, there was more coronal tooth structure over which the crown was cemented. So it was like this that time, and now the crown dislodged with that much amount of coronal tooth structure. Then if you try to re-cement it, will it gonna stay there? I don't think so. It won't stay there because the tooth structure which has to give support for that particular crown is very minimal over there. So in this case, you are supposed to reinforce that particular tooth with something stronger material, and that is called post and core. The same way you reinforce a pillar with metal rods, or the same way our body is reinforced by skeletal system. Same manner, you can reinforce a particular tooth with something called post and core, so that longevity of the crown may be more. So this is a schematic representation of this particular tooth, which is having a root canal filling, that is gatapacha. So what you are supposed to do is you are supposed to remove certain amount of gatapacha in order to create a post space. Post space is a space created in order to receive a post. So when you create a post space, you are supposed to keep certain amount of gatapacha on the apical area. See here, minimum 3 millimeter of gatapacha should be there on the apex in order to secure the apical seal. What is apical seal? Means the seal which is there on the apex, which stops the movement of microorganisms into the tooth and away from the tooth. It acts as a barrier which stops the movement of microorganisms. So that's why you should give a apical seal in this scenario. Then after making a post space, for creating post space, you can use gauge Glidden burrs or piezo rimmers. These two things are most commonly used in order to create a post space to receive a post, which is the post space what you created should be having a similar dimension post to cement with, because you shouldn't the post what you are giving, which should be almost exactly fitting to this post space. Otherwise there will be something called dead spaces, which will again inhibit the longevity of your post and core. So after making this post space, you are supposed to make an impression of that particular post space and send it to your particular lab. So your technician will make a custom made cast post and core. So the cast post and core will look like somewhat like this, in which this post area will be inserted and cemented into this post space, and the core area will replace the coronal structure which I draw here earlier, on which you can give a crown to restore it. So this is how we make custom made cast post and core. Then I'll show one more picture, one more schematic representation in which they used prefabricated post. So this is a prefabricated post. It's a metal one which is having serrations on it. So it's a serrated metal post which is parallel, in which the gutta is remaining 3 to 5 millimeter on the apex in order to seal on the apical area. It acts as a barrier, which I mentioned earlier. And this is the head of the post which support the core material. When you use a prefabricated one, the material which is made up of post and the core will be dissimilar materials. This is a metal and the core material may be a composite or miracle mix, or amalgam won't be there. Usually miracle mix, something which will be like that, over which you are supposed to give a crown. The artificial crown will be given. So if there is any forces, any off axial forces acting from the sides, that forces will be transferred to the core, which will be again transferred to the post, and which will be dissipated by transferring it onto the internal walls of your post space. So it will be dissipated by transferring to these areas. The forces which acts here will be transferred to the post and will be dissipated by like this. So I hope you understood. If there is no post here, the forces acting on this crown will be directly transferred to the core, and there is chances of dislodgement of the core from the two structure happens, and you will get a situation like this. The crown will be dislodged with certain amount of core, that is coronal structure of tooth. So in order to avoid this, you are supposed to give a post and core. In such cases, you can choose cast post and core as I explained in this diagram, or prefabricated post and core as I explained in this diagram. So this is a definition of post and core. They have given different definitions for post as well as core. The post is usually made up of a metal, or it could be other materials also. Nowadays other materials are very much common, like fiber reinforced ceramic, carbon fiber, then zirconia, etc. So many materials are there already, that is fitted onto the prepared root canal of a natural tooth. When combined with its artificial crown or core, it provides retention and resistance for the restoration. Then we talk about core now. It refers properly shaped and well substructure which replaces missing coronal structure and retains the final restorations over it. The final restoration means the crown. Now coming to the indications of post and core. Inadequate tooth structure to retain a core for a coronal restoration. Inadequate tooth structure means usually the indication for root canal treatment would be extensive caries, which may or may not involve pulp or approximating pulp. So, as the caries is extensive, the amount of coronal tooth structure loss also will be extensive. So, if there is an extensive coronal tooth structure loss, when we talk about anterior tooth, if the coronal tooth structure loss was more than 25%, it's always better to go for post and core before giving a crown. If the coronal tooth structure loss is more than 50% in cases of posterior tooth, it's always better to go for post and core before giving a crown. So this is a universal scale whether to which decides whether to go for post and core or not. It's a universally accepted scenario. You have to follow this. You have to see whether the tooth is anterior or posterior. If it is anterior, if it is more than 25% coronal structure loss, then post and core. If it is posterior and if there is more than 50% of coronal tooth structure loss, post and core, then crown. So that is a universally accepted criteria in order to decide whether to go for post and core. Then another teeth which are smaller, shorter in diameter. For example, maxillary lateral incisors and mandibular incisors, which are smaller in diameter, which are easy to break or fracture. Such teeth also, it's better to give post and core before giving a crown. So these are the indications. Now let's talk about the contraindications. In some teeth, due to resorption of root or something, the root length or the post length may be insufficient. The length may be very low. So in that case, the post length may be low and a crown height would be more. So that case would go for a poor prognosis. So it's not advisable to go for a post and core in such cases. It's always better to give just a crown. Then in canals with inadequate obturation, when you get a case for crown or post and core, you should ask the patient to take a recent IOPA. You should check how the obturation is. Is there any apical pathology? All those things has to be assessed correctly before deciding post and core. So if the obturation is inadequate, you are supposed to send the patient for a reobturation, an adequate one. Then only think about post and core. Now coming for the need for restoration of endodontically treated tooth. Why we give crowns for root canal treated tooth? What is the need for crowns? What will happen if you don't give a crown in root canal treated tooth? Most of you may say that the tooth may fracture without crown. It's not completely right. If the tooth is in an area where the tooth doesn't get any forces, if the tooth doesn't have an opposing tooth, then it's okay to leave the tooth like that. But you should assess the amount of forces which is possible to transfer onto that particular tooth. If the tooth won't have any opposing tooth, or if the tooth is in the anterior region where the patient usually doesn't bite, it is okay to leave the tooth like that. But you should inform the patient the chances of breakage is more. You should take care of that particular tooth. That is okay. But there is one more point, that is the tooth may discolor. If the tooth is in white or off-white in color, after root canal treatment, it may turn to yellow or pale yellow. So if the patient is aesthetically concerned, then the patient has to undergo a crown for that particular tooth. So, how the loss of tooth structure happens, which I mentioned earlier. The usually about 80 to 90 percentage of root canal treatment would be by extensive caries, which may or may not involve pulp or approaching pulp. So in such cases, there will be definitely you can see a lot of coronal tooth structure loss. So tooth structure loss will be the common scenario in such root canal treated cases. So if there is already tooth structure loss, it's better to give a crown, because how much ever filling material you use, how much good filling material you use, it can't replace the lost dentine volume, or it in strength wise. In look wise they may replace, but the strength wise it can't replace. So it's always better to give a crown in order to support that lost tooth structure. Then altered physical characteristics. The root canal treated teeth is easily likely to fracture. It may fracture in fragments or as a whole. The chances for fracture when a tooth is become non-vital is more, as there is no nutritional supply to the pulp or to the dentine. So the tooth become non-vital, it is becoming fragile. So it is advisable to give a crown so that the crown will not fracture. It supports the underlying coronal tooth structure from fracture. Then, as I mentioned earlier, altered aesthetic characteristics like the color of tooth may changes from white to yellow. So if the patient is more concerned about aesthetics, or if the tooth is in the anterior region, it's always advisable to get a crown which is aesthetically pleasing for that particular patient. Now, how will you plan this kind of treatments? When the patient comes to you, you should compel the patient to get a recent IOPA, or you should take a recent IOPA of that particular patient in your clinic, and you should see the obturation, how well the obturation is. Is there any periapical pathologies? Is there any perforations? All those things has to be taken care of. And if there is a good apical seal, the obturation was perfect and without any inflammation, then only you should start thinking about post-encore. If there is any inadequate root canal filling, it has to be retreated, reobturated, so that it's been corrected. Then in some cases the coronal structure may be intact. In such cases we can do the root canal treatment followed by a permanent restoration and a crown. That is the normal scenario if the coronal structure is almost intact. But if there is any substantial amount of coronal structure loss, then as I showed in the first picture that I told as an example, when patient comes to you rushing to your clinic saying the crown was dislodged with some amount of coronal tooth structure. If the case is like that, the coronal tooth structure loss was more, then you are supposed to give a crown. Post-encore before giving a crown. So you should assess it as I told in the last slides. In anterior tooth, it shouldn't exceed more than 25%. If the loss is more than 25%, the post-encore is mandatory. If it is a posterior tooth and tooth loss, coronal tooth structure loss is more than 50%, post-encore is mandatory before giving a crown. So you should keep this in your mind before starting your treatment. Or you can tell the patient also. You can show the patient with the IOPA, or clinically you can show the patient, see, this is what happens when your tooth structure loss. And if I just give a crown, because patient won't be knowing about this post-encore procedure. They might know about getting a crown after root canal treatment, but they won't be aware of post and core. So you should explain the patient what happens. You can show the pictures. This is what happens if I just give a crown. So the chances of dislodgement of crown, fracture of crown along with the coronal tooth structure is more. So you should educate the patient, you should convince the patient, because this is what happens. The crown may dislodge and they just rushing to you clinic, and that time it will take more time. It will be very difficult to do it in such a manner. So it's easy to do it before. So you should tell the patient, convince the patient for post and core in such cases. Now coming to the classification of post and core: custom made and prefabricated. I explained what is custom made in my first slide. In the second slide, I showed you a picture of prefabricated, and I will explain more in later slides. And one more thing, that is active and passive post. Active post means the retention depends primarily by threads that engage the intra-radicular tooth structure. Then passive is by retention depends upon the adherence of cementing medium, that is cast post, serrated parallel post, etc. For explain this, I'll give an example. I hope everybody would be familiar with drills, which we can make a space on the walls in order to keep a screw. Drill bits and drilling machine, I hope all are familiar with. When you make a drill hole on this wall, in a particular wall, let's imagine you made a drill hole of 5 millimeter in diameter. So the hole you created with a drilling machine on your wall, 5 millimeter diameter. And if you take a screw or a nail of 4 millimeter diameter, and if you try to put it inside that particular drill hole, it will go into that hole very easily. There won't be any hindrance. It will go very easily, and if you try to pull it out, it will get retrieved very easily. So it's easy to go inside and come out. That is called passive. Here, retention depends upon the adherence of cementing medium. In such cases, as the hole is in 5 millimeter diameter and your nail is 4 millimeter diameter, there is a difference in size, so the nail goes inside and you can retrieve it very easily. In such cases, you can use a glue. If you use a glue onto the nail and insert it, when the adhesive sets, then it will be difficult to retrieve it. So the fit in that scenario is called as passive. So that is called passive post. You have to give passive post all the time. The literature says they used active post, but nowadays you are supposed to give a post passive. You are not supposed to use the active post nowadays. The reason I will tell in the later slides. Now coming to active post, take that same example. You created a hole of 5 millimeter diameter and you took a nail of 6 millimeter diameter, which is slightly more in size. So when you try to push it inside, it will not just go like that. So you are supposed to take a hammer and hammer it, so that you have to hit it so that it goes inside. And for retrieval, you may need a hammer, other side of hammer, in order to retrieve it. So that is called as active post. In the same case, if you use a screw, you need a screwdriver in order to create some amount of torque onto that particular screw so that it goes inside, and you need that same screwdriver to create some amount of torque to take it out. So that is called active post. You make a post space in the root canal and you put a post which is having threads on it, and with the help of a small screwdriver or post driver, and you give a torque, the post will go inside. But in this case, what can happen is, when you insert a screw like that, the screw will exert certain amount of forces onto the walls of post space or screw drill space or on the walls. So when you compare it onto the particular tooth, you made a post space, you try to insert a screw post with the help of a screw post driver. As the post goes inside, it exerts certain amount of pressure. The wedging forces will be generated inside that root canal, which may cause fracture of roots. So in order to avoid that, you should avoid giving active post. You should always go for a passive post, which will be adhered by the help of luting cements. You can use any luting cement, that may be GIC, resin cement, anything you can use. So I hope you understood what I told till now. The rest of the topic we'll discuss in the next class. I hope you understood. If you have any doubts, please contact me. Thank you.